Awesome. So let's just start. So hello, everyone. Welcome to our interview series. And this time we are interviewing Dr. Goheen. Dr. Goheen is the former commanding officer of the One Dental Unit in the Canadian Armed Forces, and he's also a prosthodontist. We are so excited to learn about his journey and what led him down this path. So I guess, Dr. Goheen, I start by asking you about your background. Where did you grow up?
Well, nothing spectacular there. It was a very small town in Ontario, a little town called Port Hope. It's about an hour east of Toronto. And it's still a little sleepy spot, but it's a bedroom community for Toronto now. But a nice spot to grow up, although, as I said, nothing very exciting happens in Port Hope.
Okay, and our next question was, did you always know that you wanted to pursue dentistry? Did you perhaps have a dentist in your small town who influenced your decision, and what led you to the career option?
Well, ultimately, yes, there was. Dr. Richardson was my family dentist, and turns out he was a colleague, a dental colleague from school, with a few folks at University of Western. And so I did meet a few people through him, but not in my wildest dreams did I ever plan on being a dentist. As I said, I kind of squeaked through high school, not really paying much attention to things. And I had the joy of being part of an organization called Air Cadets. And cadets had the opportunity for you to get your pilot's license, and I did that. And so my great dream was to become a pilot, perhaps for Air Canada. And back when I started to go to university, or was about to go to university, I had thought about taking that path down the pilot thing when Air Canada announced a number of closures and CP Air folded and a bunch of things. So I said, well, I better decide something different. And so without great thought, most of my friends were off to university, so I decided to go to university as well. And when I got there, that's when I really decided that just a bachelor's degree was not going to get me much of a job. So I better think of something fast that was going to have a career path to it. And that's when dentistry really became my passion. The passion, first and foremost, was to try and get in, which I think nowadays and at the time, if you got into dental school, you'd won the lottery. Dental school or medical school. I remember in first year biology and chemistry sitting there at Western. I started off University of Western Ontario with 500 or 600 students all wanting exactly the same thing. And that's when I think the trepidation and terror crept into my mind, because before that, you just simply think, well, I'll go to school and I'll be able to get into whatever I want. And that's not the case. That's when you have to kick it up a gear and decide what you really want and then go for it with passion.
It's awesome. Yeah, and I can definitely feel the same vibe as well. When I was in undergrad, there is like so many sciences students all wanting to pursue dentistry, and that can be really overwhelming for people and sometimes deter them away from pursuing their dream. But as you said, I guess it's always good to set the path right and do our best to really go into what we really like. So
Right.
I guess we know that you you went to dental school, but can you talk about your dental school experience? Like, I guess U of T, went to U of T, but also like how was the vibe? Did you enjoy it or not? And tell us a bit more about that.
I did. I enjoyed it a great deal. Again, I think I underestimated the difficulty and the challenges of being a dental student. I thought that, the work was done now that I'm in dental school, and so I can relax a tiny bit. And so the first year was a lot of fun, but I probably should have worked a little bit harder.
Wow.
And then you decide that you really now have to grow up and be I guess responsible about what you're doing. And so that's when I really began to commit to the profession itself and all the responsibilities that we have. One opportunity for me that came up a little bit unexpected was my father had some brushes with the military experience. He's 85 now, but he at one point was somewhat involved with the Second World War and and really wanted to be part of the military aspect, but never got the chance because he was a bit young at the time. And he actually heard about the dental officer training plan that the military offered and suggested that to me. And when I explored it and found out that they were going to pay for my tuition and books and all my instrumentation and pay me a salary while I was going to dental school, I had some past experience with the Air Cadets, and so I felt as though what could go wrong. So again, it's one of these things that I believe strongly in pieces of things that brush up against our lives, and I think we call them synchronicities. And when those things happen, if you're aware and you're prepared to take that jump, and perhaps we'll talk a little bit more about those opportunities that arise, and you have a decision to make as to whether you're going to take it or not take it. Often taking it leads you down a path that you never expected. And so for me, that was it. I mean, one second I was thinking of setting up my own private practice, and the next second I was in a uniform, which didn't scare me a great deal, but it was certainly something that I needed to make a decision about, and it was a different plan than I had originally, but that certainly led to wonderful things for me personally.
Mhm. Wow, that's awesome. I guess you talked about how your involvement with the Army began, but then I guess Liz is going to ask you the next question about your specialty training.
Right. So we know that you've chosen to specialize in prosthodontics, and we were wondering what led you down that path, and if you were always interested in that specific specialty, or if through exposure you came to that decision.
It was a progression, I guess. One of the things that happens in a military career is that you start off by being a general practitioner, which I think is a wonderful way to expose yourself to all aspects of dentistry. And my involvement with the Royal College has been a number of years. And at one point, people began their specialty adventures after having a number of years as a general practitioner. And now a lot of folks go directly from general practice training through to specialty, which I'm a bit concerned about some of the lack of information that people have when they become a specialist. For me, I spent 6 years as a general practitioner, and that allowed me the time to kind of understand what my capabilities were and where my interests were. And I found that at that point, I had done all aspects of dentistry, some perhaps more successful than others, and some that I enjoyed more. And prosthodontics was the one that I actually enjoyed the most. I found it very challenging. There's a lot of things that have to go right to get a great aesthetic and functional outcome. And so the military also offered postgraduate training in not endodontics, there's an advanced general dentistry program that we offer as a 2-year program. Prosthodontics, oral surgery, and periodontics are the specialty areas for the military. Those are the deployable assets that we use when we go to operations at theater, or that we need to be able to prepare soldiers adequately enough for deployment. And so I decided that prosthodontics was where I wanted to go and applied to our military program to do it. I ended up having a great opportunity to go down to Washington, D.C. to Walter Reed Army Medical Center, where we had the prosthodontics program there with the U.S. Army. It was an amazing program. I think a lot of these specialty programs, or even dental school itself, is what you make out of it. Obviously your application of your own enthusiasm to certain areas will give you those results. I think, though, you can either kind of cruise through something and get a qualification, or you can really delve into it, understand it better, and at the outcome is a better person, better clinician. Unfortunately, at the end of the whole thing, I didn't find that prosthodontics was much easier. In fact, it's still a very challenging profession. There's a lot of things that have to go right. So I did find many ways to solve the problems that I had before as far as being a general practitioner, and became a better clinician. Dentistry is still hard, no matter what profession or what specialty you're in. It's a challenge.
No,
Yeah.
for sure. And I can really relate to that because prosthodontics is one aspect that requires people to consider all different parts of dentistry, from like soft tissues to hard tissues of the mouth, how to make them harmonious. And it's always a challenge. I mean, even undergrad students struggle a lot. I know at U of T to get one denture done or like one implant restored, and it's very difficult. So I can
It's tough.
definitely relate to that.
Well,
So
I
I
think
get,
the prosthodontist is actually the quarterback. And, aside from the general practitioner who is home base, when you start down a road of, functional or skeletal or whatever it might be that you're trying to do a correction for, or a reconstruction rehabilitation, then the prosthodontist really has to be the person that everybody else works through, because ultimately people want function and aesthetics, and we achieve that through all the specialties working together.
For sure. No, that's for sure. So we learned about you that you were deployed to Afghanistan and you were presiding over a big operation there regarding their medical and dental officers. And that was very interesting to us. And we were wondering if you could expand a bit more on it exactly. How was it experience for you, and any interesting stories that happened, and in general, if you could
More
elaborate.
stories you're looking after, are you? You know, I think you have to go back a tiny bit into a career to figure this whole thing out. So, in the military, and I keep going back to that, but it's one of those things where you have two professions. One is the profession of arms and being a military officer, and the other one is being a professional as a dentist. And in a military career, you start out seeking clinical excellence, which is what your first 4 years of after graduation are in practice. And at that point in time, your goal is to become proficient and expedient at doing dentistry. And then you begin to branch out if you so desire. And that is to begin to explore the leadership component of the military, because you really do have to kind of have two branches going at the same time. And it's a bit of a challenge to do so, particularly if you only want to do dentistry. Then you can stay in that part, but ideally you progress as you go through. And for me, I progressed through different leadership opportunities. First as a detachment commander looking after my own clinic. Second, I was in charge of the medical and dental school in Borden, and producing doing training, doing all of the things that we needed to do for our military members, because you have unique military skills that you can't get in civilian institutions. And so the military provides that. And then I did have the opportunity to command all the in-garrison, so all the dental clinics in Canada, as the commanding officer of one dental unit. One dental unit has 44 dental clinics across Canada and Europe. And we prepare soldiers, sailors, and airmen for their operational deployments. And that's essentially why it exists, is because you need to have people at their very fittest dentally when they deploy. So that's not something that they have to worry about. And the other side for us on the military side is the deployment component, which can happen at all phases of your career, both as going as a clinician or going in a leadership role. And this one came late in my career. I had other things that prevented me from going earlier. But I did get to go as the deputy commanding officer of the Rule 3 Trauma Hospital in Afghanistan. And that happened in 2011. So very senior in my career. I've been just promoted as a colonel. And so this was the opportunity that I had waited for a long time. And so deployed to Afghanistan for a 5-month period, where my responsibilities were to oversee the operational aspect of the hospital, the trauma hospital. At the time, the Canadians were beginning to pack up and coming out, but the Americans were still in full operational status, right from what we call white ops, and where people are out on deployment, just trying to protect the perimeters, through to deep dark ops, where people are out being proactive and trying to target things. And so for us as a trauma hospital, that meant that sometimes we knew, half an hour or so when trauma was coming in. Sometimes it just showed up at the door. And so it was an active theater of operations. It gave me a great perspective of what the military was all about. And also it allowed me to have a different understanding of what our medical colleagues go through as the deputy commander of the hospital. And it was a really interesting period of time. First exposure I had of actually what you see on TV as trauma coming in, and for our very brave clinicians and soldiers to deal with all that as part and parcel of what they do in their careers. It was an amazing experience, one that I would never want to miss and that I'll treasure.
Wow, that was very interesting. I feel like as dentists, sometimes we get so focused on the oral cavity and our life gets into a very like a routine fashion. But the fact that in Army you get to explore all of these different environments and work with different colleagues makes the whole profession more interesting and makes the journey worthwhile, in my opinion. So
It does, but if there's one thing I can add to that I think is very important for everybody to understand is in a career, a dental career, for instance, there are many different things that we can do. Some people explore volunteer work. Other people will do different aspects of dentistry, the business of dentistry, or go into administrative roles, things like that. But one thing that I think was really important that I stressed with the people that I mentored throughout the years, and I had an opportunity to talk to all our dentists once a year about what they wanted in their careers, was we did have this once a year sit down about where are you in your career, what do you need to do, and where are the possibilities for you to go next. And I think that made it very exciting. And I think if there's anything that I can pass on to people in private practice is make sure that you're always looking for what's next. I think that some folks, when they finish their dental school training or specialty training, and then they set up their practice, that's as far as they've planned it out. And so, you just can be there 35 years later in the same practice doing the same thing. And I'm sure that's very satisfying for a lot of people, but I think you need to build into your career spots or points in your life where you stop and you figure out whether you're happy and you're doing all the right things in the right balance, and then B, whether you want to go a different direction or not. And so I'm at a different part in my life right now, and having retired from the military, that doesn't mean you retire from life. In fact, I think at that point, the mandatory retirement for us gives us that opportunity to sit and think, okay, well, I'm still young enough to do different things. I'm still active, and what skills do I now need to develop to go to a different thing? What am I going to do next in my life that brings that sense of satisfaction that you had from dentistry for so many years?
And that's very true. I feel like even when we were like at the very beginning and we were planning for dental school, it was always that every year or so we had to reflect back and see, okay, where are we right now, what we should do to get into our goal, and sort of reflect and pursue that goal. And as you said, I feel like it's very important to have that sort of mentality for the entire life rather than just for the getting into a specialty, graduating from a specialty. So it should be just a lifelong. So were there any unique challenges for you, Dr. Goheen, as a dentist in the Army that you thought you would never run into and you actually ran into that you find that was interesting? Like, it can be either about how you went through all the ranks and you went to the top position, or it could be like about your clinical practice. So anything challenges that you thought that was interesting and you didn't expect to encounter?
Well, I think each and every day can provide you challenges that sometimes you think, I'll never get through this. And whether that's your board certifications, or whether it's a challenging case, or whether it's just you're overwhelmed with all of the work that you have to do, paperwork. I know for a lot of my friends in private practice they find it overwhelming. I think the whole message there is to take things one day at a time, sometimes an hour at a time, because it can feel very, very overwhelming. And, you can accomplish great things, but you don't do it all at once. So just to just to take a little bit at a time and work away at it. Prioritization is obviously, in my mind, a very critical skill to develop. One of the things I would do each and every day is to rewrite my to-do list. It seems like a very simple thing to do, but there was two things I did. I rewrote my to-do list every day so that on paper, and not necessarily on a computer where I can put it away. It has to be right there in front of me. And so I would, it might be 50 things long, but I would rewrite them, reprioritize them so that next day when I start, I'm starting with the very first thing that's the most important piece.
Mhm.
Now, something could completely come in and I may not get past number one on the priority list because of other things that happen. And the other thing I always did that made a big difference for me was to make sure my desk was clean and organized at the end of the day, because it can sometimes be an explosion. I do see in many cases where I visit friends in private practice, there's papers stacked everywhere. I don't know, that's got to be the worst thing to look at every morning when you come in. So, having some means to organize yourself that produces an efficient day, I think is really great, because every day is a fresh start.
Mm-hmm. Wow, that's awesome. I feel like you answered almost all our questions. And sort of to wrap up our talk, we were wondering how do you right now, and I guess when you were in the army, how did you maintain the work-life balance? Because I know in general for us as dental practitioners, it's very difficult to achieve that because our job is very demanding, but also at the same time, the army has its own unique challenges on the personal life and also on the career. So how did you try to find the balance and how did you make it work essentially?
Well, the short answer is I probably didn't do a very good job of it. It is always easy to succumb to the workload, work later, work longer, to be able to achieve, what everybody else has set out for you. I would say that, your family is probably going to be the most understanding, your kids in particular, and the ones that I see a lot of, this is when I was working with military, that a lot of younger people are actually making much better choices than we did in the past. I think the old work ethic was work harder, work longer, and eventually things will come to you. And I have seen some of my younger colleagues making absolutely fantastic choices to take time off, have kids, put their careers on hold while they do things together. And one of the challenges I think a lot of professionals have is they also have spouses who are professionals. Mm-hmm. So it is very difficult to have two parallel careers going at the same time. Someone often has to take a side seat while the other person goes to do something more important for them at the time. So give and take is critical, in particular if your spouse is a professional or a hardworking individual in another area. And I think having good, solid goals that once you've achieved something, take a break and try and celebrate it, as opposed to just running off to the next thing. And I think knowing when to take those pauses with family and build those in. We have a family calendar, and my wife's the only owner of it. But one of the things that we do is we've found out over the years that what gets on the family calendar gets done. So the first thing that you want to put on there are family vacations, opportunities for you to go and, as they say, as Stephen Covey says, go to sharpen the saw. You do your continuing education, do a trip that does both of those things together, and try and get home when you say you're going to get home, to be able to spend time with your family and do those special things. For me, it was always the pressures of the work, and unfortunately with the military, when you get to a certain level, there is so much coming in that you don't really have the opportunity to turn it off. You don't have the opportunity to sidestep it. So you have to take it full on, and that's what your career is going to do. And I finished off as the chief dental officer for the Canadian Forces, and there was a lot of input coming from higher levels that you had to do. You had to take it on. So in some cases, what you're going to have to do is you're going to have to do whatever is necessary, but you always have to have that plan afterwards. And I'm in that phase now of doing things that are for my family that I didn't get a chance to do when the fire hose was on full blast. So you do have that chance at some point to say, if it's too much, I'm gonna do something else. And I think sometimes we don't give ourselves that that choice. So, you know, you're down a road, maybe you've got a number of organizations you're taking part in, the Royal College, a number of other things that you might get involved with, even community and social activities. And sometimes you have to, again, take that pause, assess whether you've got too much on your plate. And I think one of the best things that you can ever learn is the way of saying, no, thank you. I appreciate the opportunity. I'm very honored to have been asked to do that, but I can't right at this point in time.
Mm-hmm. So coming back to the theme of saying no to some opportunities because you cannot really take it on, I feel like that's the theme is what we've been also seeing with other professionals like you, who are always telling us that at some point you have to really say that your plate is full and you have to like make sure you have time for other things in life rather than just taking on more and more and more, because as you said, it can be really endless. Awesome. So I guess,
Bruce, Bez, can I just add one thing to that, because that's important. Full plates are one thing, but making sure you have the right thing on the plate is really critical as well. So here's the thing: is that if you don't know which path you're taking, anyone will take you where you want to go. If you know which path you want to take and you know exactly how you do, that's the part about deciding which way you're going in your career. If you know that that's part of your career, then you put that on your plate and you continue to go that way. If it happens to be something on there that doesn't contribute to your long range plan, but happens to make your plate full, that's when you have to say that thing doesn't belong and you take it off, perhaps so that something that you do want to do or have to do as part of your career can go on it.
Oh, that's a really good advice. And you're right. I feel like, and also it comes to the point that you said of always evaluating and seeing where we are with respect to where we want to be, and then see if things are pushing us or helping us to go that way every few years.
And the last thing I would add there is that there are people out there that can help you do that. So it's really critical to find people that you emulate very early in your career. That, you know, for me, George Zarb, John Agar, one of my first commanding officers were people that I could talk to or emulate. And I liked what this guy did or that guy did or that person did. And that I'm going to do those things as part of my career. So talking to others, because, you know, it's far easier to have somebody that you can bounce things off of. And there's far more people out there that you can do that with than people think. So developing the right people around you is really critical.
Yeah, and I see definitely that team as well, because right now the undergrad students who want to pursue dentistry, they approach us as dental students and ask for advice. And I feel like we should also try to do the same. We should be in touch with people who have gone through the path we desire to go and sort of get advice from them and make sure that maybe we don't make the mistakes that they made, so that it would be easier. And I feel like that's a very valuable point that you brought up.
Or take the opportunities that they made and go for it. So.
Exactly. Awesome. I guess with that, our interview comes to an end, but if you can stay online, that would be awesome. So
absolutely.
Thank you so much.